Hello everyone, and welcome to lecture number 3 in the first IHF medical webinar series. My name is Courtney Gahan, and I'm the moderator for this session today. Before we begin, I will outline the translation options we have available for this lecture. We have French, Spanish, and Arabic available today, and you can use these if you are joining us on the Zoom platform by locating the globe icon at the bottom of your screen, marked Interpretation, and selecting your language. This first IHF medical webinar series forms part of the virtual academy introduced by the IHF in recent months to enable global online learning. All of this falls under the IHF Education Centre, available at ihfeducation.ihf.info. This medical webinar series sees a lecture take place every week through to December, focused on different topics within the medical field. Today, we are focusing on mental health of handball players with Professor Margo Mountjoy, Chair of the Association of Summer Olympic International Federation's Medical and Science Consultative Group, as well as numerous other titles. You can see a little bit about her in the corner on your screen right now. We are actually going to show a recorded version of the lecture. Dr. Mountjoy is with us, so she is going to answer the Q&A at the end. Please feel free to send your questions throughout the lecture. And please note this is being recorded, so you will be able to access it later for on-demand viewing. So welcome, Dr. Mountjoy.
Thank you for the kind invitation. It's such a pleasure to be here with my friends in handball. I thank the International Handball Federation for the invitation to be here, as well as my dear friend Hosni, who is also a member of the IHF Medical Group. It is my pleasure to talk today about mental health, and I will let the recording play and answer your questions after the session.
Thank you very much. So let's begin.
Margo Mountjoy, and I'm a clinician scientist, MD PhD from Canada. And it is a pleasure for me to speak to you today on the mental health of handball players. I thank the International Handball Federation for the opportunity to talk to you about this topic today, and in particular, my dear friend Hosni, who is your Chief Medical Officer. So today we're going to talk about not physical injuries, but mental injuries and the mental health of handball athletes. And I start this presentation with a picture of many athletes from different sports who have come forward in the media and into the public domain with their stories of mental health challenges as an athlete. And as you can see, there are many famous athletes here that have broken the silence, that have talked about their challenges and shared their experiences. And it is important that we learn from them and that we improve things so that our handball athletes can have a safe environment and a healthy experience in handball. I encourage all of you to watch this documentary on HBO. It's called The Weight of Gold, and it is featuring Michael Phelps, very famous swimmer who has the most decorated Olympian of all time. And he quotes in this documentary that I don't think anybody really cared to help us. I don't think they asked us if we were okay. As long as we were performing, I don't think it mattered. He shares his mental health challenges in this documentary and the lack of support that he received as an elite athlete. There are 9 other athletes that are in this documentary as well that also share their experiences. And here's another one. And this is Lolo Jones, who says, I don't think they were maliciously ignoring our well-being. I don't think they realized that it's a crisis. How many more dead Olympians do they need before they realize that there might be an epidemic here? And the epidemic meaning mental health challenges in their athletes. So I bring this to your attention also so that we can learn from these athletes that are speaking up and make sure that our handball athletes do not have the same experiences. So I've broken down the agenda of what we talk about today. I'm going to talk first about the science base. Then I'll refer to the Sport Mental Health Assessment Tool, followed by the IOC Mental Health Diploma Program, as well as athlete support tools for you, and the IHF Federation Mental Health Toolkit, and finally end off with some recommendations for handball specifically. So let's start off with talking about the science base. So this is the group of experts from around the world that came to Lausanne, and late 2018 was published in 2019 as the consensus statement, the objective of which was to provide recommendations on how to minimize the negative impacts of mental health in the sport environment to help our athletes. So there are 2 editions of the British Journal of Sport Medicine that are dedicated to this topic. Of course, the lead paper is the IOC consensus statement, but there are several other supporting documents that deal with each of these specific problems in more detail. So on the left part of this slide is the process that we underwent to develop these consensus guidelines. First of all, it started off with planning in 2017, 20 different topics for the systematic reviews, which are published in these 2 editions, as well as with the help of the library, and coming up with over 14,000, almost 15,000 articles that were reviewed to be included in these systematic reviews in this topic. These were reviewed, papers were drafted. We came together in Lausanne, had presentations, discussions, dialogue, and came to consensus. And then under leadership, these reviews were completed and published. So quite a process. It was a 2-year-long process, big project, but it's a great resource for you, great resource for physicians and for team supports on mental health issues in sport. So the things the statement reviews is, first of all, looking at a general prevalence and then prevalence of specific disorders. It reviews a clinical approach to managing mental health issues in athletes. So a very helpful, practical guide for you on the clinical approach. It talks about the athlete's environment and things in the environment that affect athlete mental health, including harassment and abuse, injuries, performance failures, and transitions out of sport. So these are times in an athlete's career, hopefully not all of them having to occur, but where mental health can be particularly vulnerable. It talks about how to deal with mental health emergencies, and as well some of the particular nuances unique to the Paralympic athlete, and closes off with future directions of where the gaps are and what you need to learn about to further this mandate. Some of the common mental health disorders in this statement and the prevalences are there. So you can see that anxiety is fairly common at least 1/3 of athletes in this systematic review. About 1/4 of the females, less so than men, had questions. Almost half of our athletes had a sleep disorder, which is concerning, seeing sleep is a very important recovery tool for athletic performance. Alcohol abuse, 20 to 25%. Eating disorders, depending on the sport, anywhere in men up to 20%, in women up to 45%, depending on the sport. Suicidal ideation, our work comes mainly from the athletics population in Sweden at up to 17% of athletes. ADHD at 5% and gambling around 8%. And we do not have data on PTSD, post-traumatic stress disorder, or bipolar psychosis. The paper also reviews the impacts of mental health symptoms in athletes, which are significant, and as well the barriers that athletes have when seeking help, and this we term as mental health literacy. So there are barriers for athletes to seeking help, and these might be, and most importantly, is the stigma within sport against mental health that stops athletes from seeking help. Athletes are supposed to be the biggest, the fastest, the best. They're not supposed to have mental health problems, which is equated with weakness. But in fact, mental health problems aren't weakness. Seeking help is a sign of strength. So that stigma is big and it's real, and we need to break the silence. We need to stop the stigma so our athletes have permission to seek help if needed. There may be an unwillingness to express emotion because of the stigma. There's a lack of awareness. There's a problem, and this came out very clearly in that HBO documentary. Might be a lack of time to address it. They might be scared of what might happen, if there might be repercussions. They might lose the spot on the team or not be selected for a team. They're not sure who to reach out to. There might be an accessibility issue to mental health support. And they might believe that if they do reach out, there won't be any help there for them. So this is in the paper by Gulliver et al. In 2012 that also talks about facilitators, or what helps athletes reach out for help, mental health help. And that's education and awareness, decreasing the stigma, social support, encouragement, having mental health support accessible both financially and logistically, having a positive relationship with the entourage, ensuring confidentiality, and integrating it into the culture of the sport with an openness and the ease of expressing their emotions. Give them time to look after their health, and having positive experiences. So if we look at athlete mental health, there are competitive stressors, and they're a normal part of sport. Do we have adequate preparation? Do we have injury prevention? What kinds of pressures are on these athletes? Are they underperforming? What are their expectations? And what are their support around a major competition? Life as an athlete is not without stressors, and it's important that our athletes learn the skills on how to manage these stressors. I'm not suggesting that these stressors shouldn't exist. They do exist. What needs to happen is our athletes need to learn how to manage it, how to cope with it, how to develop the skills that they can handle the pressures and the stressors within the sport. But don't forget that these athletes also have a personal life. What's happening in their work, what's happening in their homes, what's happening in their families. Is there academic considerations or work considerations that we can help support so that they can come to the training field or the training venue with focusing on their training and not worrying about someone back home or a situation at work. So how can we help our athletes be able to focus on their competitive stressors without dealing also with personal stresses, or giving them the skills to deal and support to deal with their personal stressors? But in addition, there's also organizational stressors that our athletes do feel, and that's leadership challenges, cultural team issues, logistic and environmental issues, interpersonal issues. So there are other organizational things that affect athlete mental health. So this is a very nice diagram by Purcell, Rosemary Purcell, an Australian scientist, mental health scientist. And she talks about the different levels of mental health support that can be required. And number one, and most importantly, is prevention. In addition to this, though, however, we should all know and have the clinical competency how to recognize, how to detect early mental health problems in our athletes. And that would lead to early intervention. And should things escalate, we should have good access and pathways to specialist mental health care. So you can see there's many ways we can intervene to help our athletes' mental health. So let's talk a little bit now about the International Olympic Committee's newly published Sport Mental Health Assessment Tool. So this mental health assessment tool was published in the British Journal of Sport Medicine in September 2020, so fairly recently. And I encourage you to look up this article in the British Journal of Sport Medicine. So the first part of this tool is actually the Sport Mental Health Recognition Tool. So this tool is designed not for physicians, it's designed for athletes, for coaches, for family members, and members of the entourage of the athlete that are not physicians. So what this recognition tool, in parallel like the concussion recognition tool, it talks about what you're supposed to recognize and what are the red signs, stop signs that says there's a problem. So it talks about the different experiences. When an athlete describes these thoughts, feelings, actions, or physical changes, so it lists them. So that if you're seeing them, you can say, oh my goodness, so-and-so on my team has expressed those thoughts or feelings to me, and I see them acting like this way, and they are behaving, and there's physical changes I'm noticing. There's some red flags that can be identified, such as harming themselves, harming others, or dramatic weight changes. Those red flags are alarming, and they instruct the person to encourage them to seek help. And then the bottom section is what to do. What to do if you observe any of these thoughts, feelings, actions, physical changes, or red flags. If you're experiencing them, or you're observing them in someone else. So this recognition tool really helps and empowers our athletes to seek help if they have these things or if they see this in others, and also equips the entourage with these skills and knowledge of what to look for, what are the red flags, and then the knowledge to know to pursue, seek help for these athletes that they've identified. So this recognition tool, it's one page, very simple. I encourage you to educate your teams on this recognition. There's also a sport mental health assessment tool, which is identified for team physicians, not only psychiatrists, but also sport medicine physicians. So your team physicians in handball should be educated on this sport mental health assessment tool. And I'm going to walk us through it today and give a couple of case examples. So here it is. There is a physician form and there's athlete's form. So that's the physician form, and now we're going to talk about the athlete forms as well. So one physician form, 3 athlete forms, depending on the severity of what we see in the athletes. Let me walk you through them. So step 1 is the athlete triage form. Step 2 are for those athletes that trigger above the threshold in the triage, are encouraged to do step 2, which is more extensive mental health screening with validated mental health screening tools. Step 3 is brief intervention and monitoring, or if they're more severe, referral on for more in-depth mental health evaluation and treatment. So step 1, as I said, as you may recall, this is a triage form. There is some questions that the athlete asks. We're asked the athlete, and it's given a score. That score from the athlete form gets put into the mental health, to the physician's form. And if they reach the threshold or under the threshold, which is 17, no action is required. The athlete is finished. They are done their screening and they are fine. If the score is above 17 or above the threshold, then the athletes are encouraged to answer the questions in step 2. So this is now the step 2 form. So it's a little bit more extensive screening. It involves a validated anxiety, depression, eating disorders, sleep disturbances, alcohol, and drug abuse. So the athlete completes these screens, and they're listed here. And then the scores from those screens get put on. So here's the scores. They get put onto the physician's form, and that number is put onto this nice colorful grid. Now, if the number, because each of these scores has a threshold, if that number is within the green, then they go on to step A, 3A, which is mental health support, cognitive behavioral therapy, and some brief intervention. If their scores are in the orange level, then that's above the threshold, then these athletes are more seriously ill with mental health problems. And there's some specific steps in 3B. Now I bring your attention to that red line. That red line is in the depression score, and that's identifying self-harm. That is red because it's to distinguish immediate action to ensure athlete safety. So that's the only caveat in all of these. Is question number 9 in the depression is positive for self-harm, then immediate action must take place. So as I mentioned, step 3A, if these screens show that the athletes are below threshold, they receive some support, psychoeducation, mindfulness training, and then monitor again with the triage form. And here they are. So if they are more seriously ill, then that would be, their scores would be in the orange box, and they are more complex. They're more severe, diagnostic uncertainty, or they've been non-responsive to treatment. And at this time, there is a further assessment tools with more serious mental health problems that can be implemented. And these would be then graded, and at that point, probably referral to a mental health specialist, a clinical psychologist, or a sports psychiatrist for management. So these are the more serious and thankfully less presentations. So we ideally recommend this to be used in the pre-competition period, but also mid-season and end of season. Or if something significant has happened, may that be a significant injury, surgery, illness, unexplained performance, the end of their cycle, competitive cycle, or if there has any suspect of harassment, abuse, or adverse life event, including transition out of sport. Now, steps 1 and 2 are very easily adapted into the online format, and I'm actually implementing it right now with 700 varsity athletes, and it's all done online. It's quite nice, and the athletes can do it on their smartphones, so it works quite well. So to summarize, there is 1 physician form. There are 3 athlete forms. Athlete 1, simple. If they trigger above the threshold, they do 2. If they trigger above the threshold, they do athlete form 3. So number 1, athlete screening. Number 2, moving on to step 3A, which is brief intervention. 3B, more serious support. And then the third one is moving on to that more serious support. So let's talk about a case. So here is a female athlete, 1984. She's been skeet shooting for over 20 years. She's a world champion, and in her preseason medical assessment, she does this SMAT, or the Sport Mental Health Assessment Tool. She's found to be healthy, and she's looking forward to the Olympic Games, aren't we all? So when she does her score, her first screen, there it is. And I know you can't read the numbers, but if you add up the numbers under the red circles, it happens to 14. The trigger happens to 17. She has not scored above the threshold. She is finished. This is all it took for her to answer these simple questions, and we can be reassured that she is mentally fit, she's mentally healthy, and no more interventions are required. She is done. Probably took her 5 minutes or less. So that is what we hope for the majority of our athletes, and that's all that we need to do for this athlete. So there she is. She filled it out, and she's fine. Now, case 2. This is a footballer, 1998. He's Swedish, happens to be a team captain, just transferred from one team. So he's having his pre-competition medical assessment by the new team. He's had no recent injuries, and he's quite a famous athlete with 2 million followers on Twitter and Instagram. So he does the screen, the same screen as case number 1. And I know you can't read the numbers there, but you'll trust me that it comes to a score of 24. Now, you may recall that I mentioned that the threshold is 17, so he triggers above the threshold. So this athlete in particular then goes on to doing the 6 very brief screens that I mentioned. And here they are. So then he's done these, and these are his scores on those 6 screens. Now it writes here what the norms are so that you can see whether he triggers above or below the threshold. So it's written here now on the physician's, and then it gets copied up into this. Now, and when they're written there, you can see that 3 of these are in the green, but 3 of them are in the orange, or the more serious, concerning ones. So this athlete is requiring more complex care. So to summarize, 1 physician form, 3 athlete forms. Step 1 is just a triage. If it's less than the threshold, nothing further needed, as in case 1. And as in case 2, the athlete needs to go into step 2. And after they've done the step 2, it gets rated to see severity, and those athletes in the green area that are below the threshold get supportive care, and those that are in the orange go on to more complex care, as identified here. All right, let's change approach now and talk a little bit about the IOC Mental Health Diploma course. So as you may be aware, the IOC has courses for dietitians, sport dietitians or nutritionists. It also has sport physiotherapy. It has a program for drugs in sport, and most recently in September 2020, it started a program for mental health in elite sport. It's run by the IOC in collaboration with a company called Oracle. So this is a program that you, as a team physician, or if you have a team psychologist, can take this diploma course. It's a 1-year course. It's all done online. It's digital and remote. Here are the topics on the curriculum. So I will not read them through, but you can see them here. It's quite extensive. It gives you as a sports team physician an idea of what the science base is, what you can do to prevent these problems, how you can manage therapeutic use exemptions around some of the medication interventions, how you can manage some of the common presentations, as well as some of the unique populations with respect to child athletes, para-athletes, and in retirement, as well as the IOC SMAT, or the Sport Mental Health Assessment Tool that I just reviewed with you. So that diploma course is rich in knowledge, and I'm very excited about it, actually. I'm giving a couple of lectures in it, and I'm really excited about the potential for this to improve team physician competency and literacy in mental health management. As a team physician, I've been a team physician for many years. My training was not in mental health. I'm a sports medicine physician, and this program will really equip all of us with the skills we need to manage athlete mental health problems to a certain level and degree, before which then they would need psychiatry intervention. There's also a certificate course, and this certificate course is shorter. It's 6 months, and the target audience for the certificate course would be the athlete entourage. So if you had a team physiotherapist or someone who travels with a team who really just wants to learn more about athlete mental health, what things to recognize, what their role is and responsibility. And this is also a very interesting program, shorter in nature, being 6 months, and you get a certificate at the end as opposed to a diploma. So very, very good course for those non-physicians and non-psychologists amongst the entourage. Next, I'd like to talk about the IOC program on MentallyFit, and it's called #MentallyFit program. So this athlete initiatives from Athlete MentallyFit program is on the Athlete 365 web pages. So it's free, it's easily accessible for your athletes and for you and your coaches. This program is really targeted at athletes and coaches. It's not targeted at team physicians. But as a team physician, I really like looking at it because I want to see what our athletes are looking at. But I also find I learned some important things as well. So the goal of this is to lead the conversation and to decrease stigma, to encourage athletes to talk about their mental health, and to equip them with some knowledge on how to recognize the problem and how to seek help. So there's articles, there's interviews, there's media content, there's athlete stories, there's professional stories. Dr. Claudia Reardon, who is the lead author in the IOC consensus statement, she gives a talk, especially during COVID. She gave a very good talk about mental health during COVID-19. So through this content, the goal is to really raise awareness and drive the conversation to improve athlete mental health. So in addition to this online Athlete 365, there's also resources being developed to be implemented for the upcoming Tokyo Olympic Games. So this is very exciting for me as someone who's attended many Olympic Games in the past, that we will actually have some programming available for our athletes and team physicians in Tokyo 2021 for mental health and support for mental health for our athletes. So what are some of the things that are being done? Well, there's the International Athletes Forum, where there was a panel discussion and recommendations coming up from this. So this was this forum occurred last year in Lausanne and brought about 400 or 500 athletes from different international federations and national Olympic committees to Lausanne under the IOC auspices. And this is a very exciting, attended this talk. It was an exciting panel discussion with an international federation president, current athletes, and a mental health specialist. So it was a very rich conversation on the stigma, on the problems and solutions. There's been a lot of work being done on raising awareness. There's been a development of a video that links mental health with physical health. Now, we as physicians know this. We know that athletes who are mentally unwell will not have good physical performances, and we know that athletes with physical injuries can have some mental health sequelae to that. But not everyone understands that link between the mental health and physical health. So this video does a great job for athletes and coaches to raise awareness on the importance of linking mental health with physical health and performance. There's some well-being support. There's a program called Headspace, and this is a meditation and sleep app to help reduce stress and improve happiness. This is available for athletes to use through the Athlete 365 website. That just helps with coping and would help with stress management for athletes. So this is available and free for athletes to use through the Athlete 365 as a method of well-being support. There's that athlete mentally health or mentally fit during COVID interview, and it's quite lovely. If you can access on Athlete 365, it's with listening to Dr. Reardon's sound advice on coping with COVID-19 and trying to stay mentally fit for athletes. In Lausanne 2020, so the Youth Olympic Games, the Winter Youth Olympic Games was the first one to have an athlete interactive educational program on mental health during the Winter Youth Olympic Games. And as well on Athlete 365, there are mentally fit tips, which athletes' voices, as well as expert voices giving advice and direction on athlete mental health well-being. And these are all free. You can access as well as your athletes and coaches through the Athlete 365 on Olympic.org. What's happening for Tokyo? So here's a little bit of insight as to what's happening. There will be a booth in the Polyclinic for athlete mental health. There'll be handouts and giveaways with educational materials and interaction with athletes to help decrease stigma and raise awareness on the importance of their mental health. There will be an incentive program where it's PinQuest, where there'll be mental health questions asked through their support phone that they receive when they come to the games, that will direct them to as an incentive to come to the Polyclinic to look at the mental health program. There'll be a Tokyo 2020 app, which will give them access online, designed for both athlete and the entourage on mental health, where to seek help during the games, but also on educational components that will be delivered through this app. And then the program will be the Mentally Fit campaign that will be both online and in the Olympic Village with a physical presence as well as an online presence during the games. There'll be branded communication that's aligned with the Athlete 365 communication I've talked about already, that's of which is to increase awareness, recognition, and decrease stigma. And finally, there'll be a 24-hour, 7-day-a-week helpline that will be implemented during the games for athletes to call for help, and it should also continue for 4 to 6 months post-games to help athletes through that difficult transition period post-games. And I don't know if you've noticed this, but in my practice with my Olympians, the hardest work I do is post-games, dealing with the mental health of athletes who are having difficulties post-games. This is a really significant high-risk time. And for those team physicians watching today, please don't stop the day Tokyo finishes. You have to continue your care of these athletes, even if they retire, because this is a challenging time for many athletes after the Olympic Games. Let's move on now to talk about international federation support. And there, the IOC is developing a mental health toolkit to help international federations. And it will parallel somewhat the harassment and abuse toolkit that's being developed by the IOC, but of course, specifically focusing on mental health in particular. So the objective of this toolkit is to assist international federations, national Olympic committees, entourage and health professionals on how to develop and implement initiatives that will protect and promote mental health and well-being in our athletes. So it's going to be a guide that will be very helpful to give you tips and ideas on what you can do to help your athletes. So the first section will really be an introduction and review a lot of the science around what kind of problems occur, what do we need to look out for, what are some of the particular populations, and really it will mirror what's in the IOC consensus statement that I reviewed earlier in this talk. So that's section 2, talking about mental health in athletes, reviewing the science, mythbusters, and making sure that everyone using the toolkit in sports, so international federations and national Olympic committees, are familiar with what the problem is and what the science says, so myth busting. The third, and this is a really important component of the toolkit, we'll be talking about roles and responsibilities. What is the role of the different members of the athlete entourage, including the athlete, the coach, the entourage members, sport leadership, team physicians, etc. So what is their role? And also, what's their responsibility? And it doesn't just stop with the team physician. It is actually everyone in sport who has the responsibility to ensure athlete mental health and well-being. The fourth will be a very interesting component of the toolkit, and this is one that takes the athlete journey from beginning to end and where the different components of athlete mental health come into play and how you can have different interventions at different times in the athlete journey. So this actually helps you walk through that if you're dealing with a development team or a junior championships, what's different than dealing with a senior championships or someone who's about to retire from post-Olympic Games? So this athlete journey will be very helpful because one size does not fit all. What you implement with a retiring Olympian is very different than what you would implement in someone who's just entered the international world as a junior athlete for the first time. And the last part of the toolkit will be a resources and a checklist so that you can be sure that you're doing the right things and there's resources there for you to help you develop the program that you'll have for your own organizations. So in the introduction, they go through, and I'll just dive into some of these in more detail. What's the reason for the toolkit? Who's the target audience? How is it developed? And how to use the toolkit. The second component, the mental health symptoms and disorders, really, as I said, mirrors the consensus statement with a general introduction. It talks about prevalence, terminology. And then the roles and responsibilities go through the different stakeholders within sport, what their roles and responsibilities are, in particular around building a mental health team for the International Federation and for the National Federation, as well as developing prevention strategies, how to screen, how to manage different mental health presentations, how to refer, and what to do in a crisis situation. The athlete's journey, as I mentioned here, is shown much more eloquently in a visual format, which shows the different components you have to pay attention to throughout the athlete's journey. And finally, number 5 there, the online resource library to help assist. The final section of my talk today is revolving around what IHF can particularly do. So political prioritization, it comes from the top down. Having a statement in your foundational guiding documents, in your documents that your constitution that prioritizes athlete health and well-being, including physical and mental health. And that gives a clear message to everyone in handball that mental health is an important priority for your federation. Having a mental health action plan through your social media to decrease the stigma for athletes, to encourage them to seek help and to normalize that mental health is an important component in addition to nutrition, in addition to making sure that we have healthy joints, healthy muscles, healthy cardiovascular systems, that mental health is a part of being an elite athlete, and that we should be monitoring and supporting it much as we do to the athlete's physical health and well-being. The IHF can develop and should develop an emergency action plan and a management plan. What do they do if there are an emergency? Now, I know you have an emergency if there's someone who is down on the field of play, if there's an injury on the field of play during a game, if there's a sudden cardiac event during the field of play. There's an action plan. There's predefined roles and steps and management on what to do. What is your predefined steps and management program for a mental health emergency? That's something that should be developed and defined and people trained and practiced in. physician education, and here we are today. So you've got one already off the list, educating your stakeholders and your team physicians to develop competency in mental health. So today's a great start, but I encourage you to look at the IOC Mental Health Diploma program, as well as some of the literature that I reviewed today to improve your clinical competency in managing mental health. Educating your coaches. So coach development on prevention, but also early detection. Remember, I mentioned the recognition tool. Make sure that all your coaches attending the handball, International Handball Federation events have a training course on how to use the sport mental health recognition tool and what they can do to help prevent toxic environments that lead to mental health problems. For your host organizing committees, making sure that there's mental health support available for your events. Is there someone that is readily available and accessible that understands the pressures of elite international sport competition? And as well, including a mental health professional in the IHF medical committee. Is there someone on your medical committee that has mental health expertise that can help inform the International Federation and also drive some of the educational initiatives for you? And finally, and very importantly, is implementing your policies and procedures to prevent abuse and harassment in sport, because we know that harassment and abuse in sport leads to mental health problems in the athletes as a consequence of the abuse. So a good intervention to decrease mental health problems is decrease harassment and abuse, stop the problem from starting. Now, mental health problems can come for many other reasons other than harassment and abuse. Not everyone with mental health problems has had harassment and abuse. However, we can prevent a significant chunk of them if we prevent harassment and abuse within our sport training environment. So in closing, I would like to thank members of the IOC Mental Health Working Group with whom I have developed a lot of the materials that I've discussed today on this talk. These are individuals from around the world. Vincent is our Guptabarj from France, but from Amsterdam is our lead. Rosie Purcell from Australia is a psychologist. Dr. McDuff is a support psychiatrist, as is Dr. Curry. Dr. McDuff from the US. Dr. Curry from the UK, Dr. Patukian and myself are sports medicine physicians. Dr. Blauet is with the International Paralympic Committee, also sports physician. Abhinav Bindra, very famous IOC Commission member who has had great input into what we do and how we approach this problem. He is our athlete voice and representative, and Nico is from the IOC itself, who helps interpret and translate what we scientists and physicians come up with, and he translates it into action for us. So we're grateful for his role on our group. So thank you, and I just want to acknowledge these people who have developed a lot of the materials, as I say, that I presented to you today. And in closing, I would again like to thank Hosni and the International Handball Federation for inviting me today to speak to you. And in particular, I'd like to thank each and every one of you for, first of all, listening today, but second of all, and more importantly, for your action on what you will do after the talk today and what you'll take home and take away from this and what you will implement to improve your athletes' mental health and well-being.
Okay, thank you very much, Dr. Mountjoy. This was very interesting, I think, for everybody. We actually just have one question so far, but I think there might be a few things to explore within it. So let's see. The question is how to help athletes sleep the night before a big match, the final or something.
Okay, I can just confirming that you can hear me okay?
Yes.
Wonderful. So thank you for your question. This is one I often get in my clinic, that people are concerned because of the anxiety and the nerves that they aren't going to sleep well, or they know that historically they do not sleep well and they want assistance with sleep. And this is actually something that I think is very important that athletes realize. If we look at the science of sleep and performance, missing one night's sleep or having a bad sleep the night prior to an event actually does not decrease their performance. And once athletes understand that, they kind of relax and not worry about it. And often that's all they need to have a good night's sleep the night before. Another thing that I often advise athletes about sleep the night before an event is there's something called Headspace that's on Athlete 365, and it actually has some tools that the athlete can listen to that helps calm, that helps them relax and improves their sleep. So the first part of it is assuring them that if they don't sleep very well, it's actually not going to affect their performance. The science is very clear on that. The second is trying non-medicated ways to sleep the night before. A few athletes obviously do use sleeping medication. I try to stay away from it because it can have negative effects, and certainly you never try anything new for the first time prior to an important event that should be tried at least in trial throughout training or at other events. But I prefer they not use medication because of the potential effect that it can have on the next day in some people. So very important question for many athletes. Thank you for it.
I would just like to ask you then a little bit more about sleep. What about generally? I think this can sometimes be a symptom of ongoing problems if people are having problems sleeping. So can we talk about that a little bit?
Yes, absolutely. And sleep, as you can see when I put up the prevalence data, was almost 50%. So sleep disturbance or abnormal sleep is actually fairly common in our athletes. And I think it's probably multifactorial. I think probably the causes of this might be poor sleep hygiene, poor sleep habits. In the age group of our athletes, people are very used to staying up late, too much screen time in the end of the night, sleeping in the next day. So they have erratic sleep hygiene. And one of the things that we try to work with athletes, especially those with significant sleep disturbances, is having that regular routine, going to bed every night at the same time, getting up every morning at the same time, and having that routine, because our bodies do work on a circadian rhythm that like that regular routine. Now, of course, that's difficult to do when you're flying, but there's a whole other science on how to improve sleep and time adaptation. And that is something that we also work with athletes at the elite level who travel a lot, is improving their circadian rhythm. Part of that sleep hygiene is also decreasing screen time in the evening because of the light in the eye, having a routine that's relaxing before bedtime, avoiding caffeine after noon. So there's many things that are that age group could work on in terms of improving sleep. Sleep medication is not the answer. The answer is improving your body's rhythm. And sleep is so important, not just for feeling well and not fatigued, but that's where we recover. Sleep is an integral part of adaptation to physical training. So we know it's important that you show up to training and you try your hardest and then you get the adaptation from being there, but the muscles repair and the adaptation occurs during sleep. So sleep is a really integral part to an athlete's development. And I think we haven't paid quite enough attention to educating our athletes and our coaches of the importance of what sleep, the role sleep has in athlete performance. So what's disturbing to me is the amount of athletes with sleep problems knowing that the sleep is so important to athletic performance.
Yes, one reason I ask about this is because I know a lot of the top players in handball have spoken about that this is actually a very important part of their routine.
Yes, absolutely. So thank goodness if your athletes know that, that means they've been educated and they understand the importance of that. And it's, you know, it's the sleep hygiene. It's an important tool that they must have. They know how to wear the latest equipment. They know how to train and monitor their body's adaptations. They know how to monitor blood work, MVO2 max, strength, and all of the different tests that monitor their physical ability. Let's pay some attention to sleep as well. And start early. Let's start it in our junior levels. Let's start it, you know, when they're young. Their mothers put them to bed at the same time and got them up at the same time. Let's take a lesson from mom and improve sleep hygiene in our athletes.
This is actually just from me. I would like to ask you a little bit more about the mental health situation now for athletes because of COVID. So obviously we had the Olympic Games postponed. It's been a very strange period for a lot of athletes. Can you speak a bit to this about, I suppose, generally how coaches and other people working in handball can help the players who may have been, it's a very strange situation for them?
Yes, thank you for your question. It has been challenging times for everyone. Nobody wants this reality in life, and athletes have additional pressures. I've recently published a study on the mental health of footballers in professional footballers during the lockdown, and we did an anxiety screen and we did a depression screen in this group of athletes pre-pandemic. We weren't planning the pandemic. It was, we had captured the data anyway. And then we repeated the same screens during the lockdown in the spring. And not surprisingly to any of us, what we found was there was statistically increased anxiety and depression symptoms in this group of athletes during the lockdown. And that what they identified were postponement of the Olympic Games, being locked out of training facilities, insecurity around their future as an athlete, insecurity around finances because they're not playing. So there was significant strain on athletes through this time period. And I don't think that's a surprise to any of us because everyone's feeling it, but athletes have an extra concern. I was also co-authored another paper by Dr. Claudia Reardon in the British Journal of Sport Medicine that talks about managing mental health during COVID. And this is actually a very helpful paper for team physicians to read about how to manage this. And you know, part of it's keeping in contact with the team, keeping the team socially connected if they're remote, giving them training so they have that routine, giving them a routine to the day because they've used to a routine day that's very well structured. So give them the same routine, but have it obviously as remote as your country's needs are. Some countries are able to train together. Some countries aren't able to train together. So giving them the routine throughout the day and having mental health supports available, because they're more likely to have needed it right now. Some counseling, perhaps a sort of sports psychiatrist if need be, and being able to recognize when those athletes, which athletes on the team need a little more support than others. There's actually very good resources on Athlete 365, the Olympic.org, on coping with COVID-19. Dr. Reardon gave a webinar for athletes on how to cope during COVID-19. So that's a resource for handball athletes. It's free on the 365 website that gives some very helpful tips on how to cope during COVID-19.
Great. Okay. Thank you so much. There are no more questions.
Courtney.
So yes.
Courtney, Courtney.
Yes.
Yes. Can I make comment, Courtney?
Of course.
Really? First of all, thank you for my colleague and my dear friend, Professor Margo, about these very valuable lectures. I would like to ask you, if you recommend that before a very important event and in pre-competition like World Cup, especially final, semi-final, can we reassist the player mentally and psychologically to ensure them for this big game, especially, you know, there's a high rate of injuries, usually in 5 minutes of the last 5 minutes of the game. Do you recommend this medical assessment? We must do it before any competition or once per year?
So you're talking about, I think, the sport mental health assessment tool. And I wouldn't suggest you do it right at the time of the event. I think it should be done in the off season prior to travel perhaps, or certainly pre-season and then mid-season. And you'll know which athletes by that point need more support than the others. And then you might want to do part of the sport mental health assessment tool just with those particular athletes, because the other ones who have done well and they're well below that threshold in the screening, they probably don't need our help. But identifying those who will need the help, and you should identify them long before the night before the tournament. And those ones should have help in place so that they can get assistance for their mental health if you have pre-identified them in the season. So very good question, Hosni. And again, thank you, Hosni, for the kind invitation and for your valuable contributions to ASWAF. You're a valued member of our group, and what you bring from handball to our function is very much appreciated. So thank you.
Thank you very much.
We have had a few more questions come in from Facebook. Sorry, yes, from Facebook. Sorry, got confused for a second. Well, people are just, what you mentioned, I think, about screen time before going to bed. I don't know if this is strictly mental health related, but can we talk a bit about this? Somebody asked about how to handle this and how to help the athletes understand this. And
yeah, that's very good. I think it's education. And how do you encourage an athlete not to be on screens, just prior to bedtime? And it might be that they're on screens until 1 hour prior, and then, what can they do? They can listen to music, maybe giving them alternatives. So what else can you do? Listen to music. You could read a book. You could have a hot tub or a hot bath or something like that. You could, spend time talking to a significant other person. Hopefully in your home or on a telephone that's not a screen. So just having a relaxed time, whatever it works for that person to relax. And each person knows what their own, what works for them, and get them to encourage them to try different things and see what works best for them. And beyond just the screen time, it's also what the room is like. So having it slightly cooler than what you'd have in the daytime, having light and sound eliminated in the room, making sure that the bedding is of a comfort level for that person's temperature, and external noises removed. Maybe that might be animals, or have them sleep in a very conducive environment. Now, when you travel, that's more of a challenge because you can't always control your environment, but knowing what you need and what you want as an athlete would be very helpful. And it's best if the team manager can help get that kind of accommodation for the team.
Yes, it's interesting. I think a lot of the players know the things they need to do to perform at their best, but I wonder if they have the same
exactly
attitude to the details for this. So we have one more question that's come in, so let's address this last one. Somebody asked about if you have a negative streak of results. I'm not sure. I think they're referring to the assessment tool. So let's go with this. So if you have a player who consistently is having very negative results on this assessment tool, how can you help them address their behavior and address this?
Okay, so I'm not sure if they're asking about performance results, because if they have a negative stream of performance results, that's when we should be doing this sport mental health assessment tool. So if that was the question, if they're not performing well and the results are negative, that's when we should be doing this assessment tool, just to make sure they're okay. Is there something going on in their mental health that's affecting their performance? So that'll be maybe how I interpret that question.
Yeah.
If the interpretation of the question is yours, if they have negative results in the screening tool, that's level 3A and 3B on this screening tool, which says in 3A, if their scores are below that threshold, they have brief intervention, cognitive behavioral therapy, and support, and then it's repeated to see if it's had an effect. If their scores are in the orange or red zone on this screening tool, that's where you need to do further assessment, further diagnosis, and more in-depth treatment, and perhaps even referral to a sports psychiatrist for further support. Because as a sport medicine physician who's a non-psychiatrist, there's a limitation to what our skills and capability are in the mental health. And I know I'm comfortable with athletes up to 3A, where I can prescribe for depression and anxiety. I can do, with support of my mental health psychologist, some brief intervention. But when it becomes more complex or non-responsive to therapy or more severe, that's when I need the help of a sports psychiatrist. So if it's negative results or we say higher or more severe results on the screening tool, that's when we divide them into going to step 3A, brief intervention, cognitive behavioral therapy, some medication, or 3B to the more complex. So either way, I've given you an answer, whatever the scenario is.
So if you say that if it has been a negative streak of results in the actual competition, so then you would apply this tool, and then you would basically proceed as you've just said.
Yes, just follow it. So maybe that their mental health is affecting their performance, or maybe the negative or difficult or poor performances are causing some distress. either is feasible. Mental health can negatively affect performance, and the corollary of that is having a string of bad performances certainly can have a depressing or an anxiety effect.
Okay, it is exactly our finishing time.
Perfect.
And I think we'll stop here. This has been very fascinating. Thank you so much for all your discussion. So I will let everyone know what we have coming up next week. We are back next Tuesday at 2 p.m. Central European Time. And next week we are focused on performance nutrition, what's in it for the athlete. It will be presented by Professor Louise Burke, Chair of Sports Nutrition at Mary MacKillop Institute for Health Research, Australian Catholic University. So once again, thank you so much, Professor Mountjoy, for joining us. I know it's early in Canada.
That's okay. I'm at my clinic and my first athlete has arrived, so I will say goodbye. Thank you again for the kind invitation. I encourage everyone to join Professor Burke's talk. She's a dear friend, and her I always learn so much from her. So it will be a very high quality lecture. So please do join Dr. Burke for your next lecture. Thanks again. Bye-bye, everyone.
Bye. We look forward to the next week's lecture very much, and we will leave it there. Thank you so much, everyone, for joining us, and we will see you next Tuesday. Goodbye.